Nikki. How are you?
Hi,
I can hear you.
Nikita.
How's
Can
it
you hear
going?
me? Good. Hi, how are you? Hey, okay, great. So this is Dr. Mehra. We have the privilege today of having Dr. Shah on with us to talk about obesity medications. So thank you for
Thank you
joining.
so much.
Thank you for
Thank you for
joining
having
us.
me.
Sure. So Dr. Shah is a board-certified family medicine and obesity physician. She's also a certified weight loss coach, and she is dedicated to preventing and treating and reversing the complications of obesity. So she is joining me today to talk about the obesity medication. And Dr. Shah also has experience in opening her own practice. So she has her own weight loss practice called Weight Sense Lake Nona. Did I say that right? And she's an obesity medicine practice in Orlando, Florida, and she provides a personalized approach to obesity medication. So we're going to talk about that today.
Thank you for having
me.
me.
Thank you, Dr. Shah, for joining us. So can you tell us a little bit about your practice and your approach to care?
I'm an obesity medicine doctor. My background's in family medicine, and I really started noticing that when my patients were coming to me in the primary care side of things, most of the chronic conditions that they were facing were really like rooted back in weight and lifestyle. And at the end of the day, when we're managing diabetes, high blood pressure, high cholesterol, I felt it was a disservice to not really address the predecessor to that, which is weight. And it was really also something that patients really wanted to talk about as well. They really wanted to find out, like, how can we live better? How can we live healthier? How can I not feel so achy? Or how can I get more energy? And it kind of just naturally progressed that I started diving more into obesity medicine and also lifestyle medicine and health coaching. And eventually I just felt this pull to open up my own practice to really address these.
Mm-hmm. And so what's your approach to care when you see your first patient? So for example, if somebody wants to come see you, what do you emphasize first, and how important do you think lifestyle is in management?
I think lifestyle is tremendously important. Lifestyle takes care of 75% of our medical conditions, and really can be addressed during these visits. But the caveat, and I think where obesity medicine also comes in, is there are people who have wonderful lifestyle habits and yet still may struggle with their weight. So when people come in to see me, when they're first coming in, like, no one really wants to go to an additional doctor, but they're coming in now because they've likely tried several diets, several ways to lose weight. They know that their weight is putting them at risk for future medical conditions, and they're kind of tired of like the fad diets and the yo-yo diets and whatever else they're flying. So they're really looking for an expert to like calm down the noise and guide them. So my approach really is first just like understanding the patient, where they're coming from, what sort of things have worked for them, what haven't worked for them, and really the individualized piece is like, what do they want, not what I. So when I speak to my patients and clients, really, I'm trying to find out, like, have they armed themselves with all the lifestyle techniques and like met with every sort of lifestyle individual, and like, do they really have great habits? And now are they just to the point where they're doing things, but their health is still in danger, and now they want to explore medications? Or do they need medicines to help make some of those lifestyle changes they've been trying to make stick and be more effective as well? So I don't think it's one or the other. I think it's really just taking a patient-first approach and kind of leaning in towards where the patient wants to go.
Okay. And I wanted to say, Dr. Shah and I are both obesity medicine certified, so we do follow evidence-based medicine with regards to obesity management. And we know that obesity is a chronic disease. It really starts in childhood for a lot of patients and then progresses through adulthood. And so, Dr. Shah, I'm happy to hear that you say that a lot of this is based on lifestyle. But when someone comes to see you and they've tried all these fad diets and they've tried to change their lifestyle, they've tried to increase their exercise and their activity level, and they just haven't had any luck. At what point do you say, okay, now it's time to start medication? Is it based on if they have diabetes or if they have any other conditions, or when do you say, okay, now let's
It's always like
start
a
thinking
risk
about some medication?
versus benefit discussion. And by the book, if we're looking at guidance, it's based on BMI, which isn't a great which is not a great indicator of, say, like someone's health, but it's a good screening tool just to know, like, how can we categorize people. I go above the BMI in my clinic by even checking the body fat composition to get like further information. So the way I start is, like, gold standard would be thinking, if you have a BMI greater than 27 in a medical condition, we can start discussing medications, because now medications are going to outweigh, the benefits of medication are going to outweigh the risk of the medications. And then BMI greater than 30, absolutely, we can start talking about medications. Being in Florida, especially in Orlando, I do want to put like a little asterisk by the BMI. Many of us we have different ethnic backgrounds. So the BMI threshold is actually lower depending on our ethnicity. So I also take that into consideration too. And then if we look even further than that, where body composition comes into place, if we are at a lower weight, but say we have more adipose cells, the adipose tissue over muscle mass, and our fat mass is greater, then that also puts us into a category of obesity, where then we would also talk about medications. So it's not really cut and dry, but that's what that first visit is all about. And I spend like an hour plus sometimes kind of getting into these little granular details, because I want to make sure like what I'm doing is safe for my patient.
Right. So, I mean, we'll take that back a step. So you're saying if you are a different ethnicity, for example, if you are Indian or Southeast Asian, like we are, in your BMI category may be at a lower level before you would consider treatment.
Absolutely.
Is that right?
Because based on ethnic variation, there is more of a risk for diabetes and high blood pressure and high cholesterol to start at lower weight thresholds than, say, someone who isn't Southeast Asian or something so there's a difference.
Okay. Yeah, so maybe talk us through the medications that you use. And I know you treat mainly adult patients, but if we're looking at patients 18 and above, what medications do you feel like are beneficial and when? So the typical one, for the pediatrics that we've used for a long time has been metformin. It's not really indicated for weight loss, and the measurements for weight, or the treatment for weight loss in pediatrics has been, hit or miss. So sometimes we're using it if patients have diabetes or other conditions, but have you used metformin for weight loss in patients, and what has been your experience?
Absolutely. I think metformin is a great option for the person where it's a fit. So if someone has insulin resistance or prediabetes, and we want to try something that has lower risk. Side effects are mainly GI related, and it's an accessible medication. I've definitely had experiences where people have had like a wonderful response to using metformin. I've also recognized that it might just be like a 2% change total body weight loss as well. So it's definitely a tool to consider. But again, it's for prediabetes, insulin resistance, and it may be beneficial to a person. Okay.
What is your next step that you would use? Do you ever use orlistat?
Not typically, mainly because of the side effects profile. So orlistat prevents like the fat absorption in the gut, and the biggest side effect is like loose, greasy stools. But I can consider it if I feel like it might be beneficial to a patient. I really categorize like the medication discussion based on what I'm picking up during the medical exam, because weight and the reasons for weight gain are so individualized, and it's really like it's based on the person's, we can say, phenotype. So if they're if they're just like battling hunger all the time, and there's and it's like constantly someone's feeling hungry, which can amplify as we lose weight too, because if we're losing weight, sometimes the hunger increases just simply due to the fact that a person is body is trying to get them to eat more. and return back to their baseline.
Mm-hmm.
So in those cases, a medication like phentermine or its similar symptomatic mimetic medications can be useful as long as there's no contraindications. It is a controlled substance, so we take that into consideration as well.
Yeah, so tell us a little bit about phentermine, if you could break it down. So tell us a little bit about how someone takes it. And so this is the medicine that you're saying you would give to somebody if they tell you that they just have a lot of cravings for food.
More so hunger,
Is that right?
not necessarily cravings, but more so if they're experiencing a lot of hunger and it's not as easy to manage for them. And it's a medication that's readily available, and as long as there's no cardiovascular disease concerns that I'm worried about, where someone couldn't be on a medication that's can increase your heart rate, then I would start it. I usually start low, and it's 1 tablet in the morning or half a tablet based on the dosing, and watch for a response based on that. So,
yeah, and so so do you change the dose? So how frequently do you change the dose of the medication, and what are some of the side effects that people could experience?
In terms of the dosing, I think that's a little outside of the scope for the live, but I'm more of a go slow and see. I don't start them on the highest dose. I've had great effects. I've had great responses just on the least amount of medication needed. In terms, the second part of your question was side effects. The first, insomnia, increased heart racing, anxiety, and I counsel clients on that as well. That if you're someone that's anxious, you may feel anxious. I will say though, it's generally people, if they tolerate coffee and caffeine well, after about a couple days or a week, those effects do wear off. So that's really that's how I start with it.
Okay, good. Anything else you want to tell us about phentermine? Okay, great. And how about Qsymia? What are your thoughts
that's great.
About
it's mixed with
medication?
topiramate, which is a anti-seizure medication that they found also helps with cravings and binging type of behaviors. So for the right patient, that might be also an option, and it is indicated for long-term use as well. Cost-wise, I believe it's about $100 a month if you're getting it from the manufacturer. My little asterisk on that is if somebody is of reproductive age or could get pregnant, that's where we would hesitate because there are birth defects associated with topiramate.
Okay. And what are the side effects of that one?
Primarily what I've said with the stimulants, and then it's for the right person, it can be well tolerated. So really with all these medications, if there is a side effect that we can't manage, then we would come off of the medication. Not like we want to always consider medications with their risk versus benefits and how tolerable it is. So just because something has a known side effect does not mean the person taking it will experience that side effect.
Okay. And again, you mentioned that this is a medication that could be used for a long-term use in addition to lifestyle medication.
And really that's all medications, including phentermine, because if we're starting someone on a medication or treatment, you don't want to just pull them off when they've reached a threshold. The idea is that it came to a point where we were using lifestyle interventions, and now we're considering medication. And when we prescribe a medication, we're not going to just pull it back at 3 months. The idea is if it's successful, someone is tolerating it well, they're not experiencing any personal side effects, we monitor, but then we continue.
Sure. Okay, great. And then how about the ones that have gotten sort of the most press, the GLP-1 receptor agonists? So what is your go-to? What do you think about those medications? And can you tell us a little bit about how they work?
The most common one that has there's 2 GLP-1 agonists that are FDA approved for anti-obesity treatment. The old tried and true is Saxenda. It's a once-a-day injection medication. And then the newest kid on the block, I like to say, is Wegovy. And really, it's about, the first thing is like access to the medication. So is it covered by your healthcare plan, and is it accessible? The second thing is like how it works. So these medications work on satiety and fullness. So it helps to slow down the digestive tract, and it can help provide a fullness signal to the brain. And people start noticing that they're full and they're satisfied after eating a meal. So they may not finish the plate fully, and they're able to kind of not seek food out for reward purposes, because, you know, we eat for more reasons than just to fuel us. We may eat for reward and other things. So there's more of a control because they're satisfied after eating the meal. And the medications, this is opening up a new wave in the obesity treatment era, because some people are getting like 15% total body weight loss. So I think the other piece when we're talking about weight and weight reduction and obesity medicine, I can't make anybody like snap my fingers and say, oh, yep, you can lose like 50 pounds or 60 pounds. Or, like, we're talking about a weight loss that's proportional to improve your health, and that might be 2%, 5% total body weight loss, 10% total body weight loss, and maybe 15. We all have blockbuster patients who, like, they'll be on a medication or a treatment plan, and, you know, they might lose like tons and tons of weight. But for most people, I think the goal needs to be realistic. And so that might be between like 5 to 15% total body weight change. And the idea is we're looking for non-scale victories. Like, the only thing isn't the scale. Like, we want people to feel better. We want them to be able to move. We want them to have their health return, feel better overall. So although our treatment starts with like a number in a medical condition, we are really trying to improve someone's overall well-being. And so the number to do that is very different. And sometimes weight means no weight loss.
Yeah. So what are some, so what are some like non-scale victories that you've had your patients talk about with regards to, you know, when they're on these medications? What do they say? Not looking at the scale, but, you know, how does their life improve?
People just start feeling in control. And weight, I think I love weight, dealing with weight and lifestyle the most, because when people start to notice like 10 pounds come off, 20 pounds come off, they're just more confident. They notice like mobility is better. They feel better. Like, they're waking up and it's like clearer. You can think better. You have more longevity. When one piece is put into motion, people like start to do really incredible things in all sorts of areas of their life. It's magical.
Yeah. And so what would you tell people who are interested in finding out more about obesity medication? I mean, do you think, is this something, when you were seeing patients as a family practice physician, is this something that, you know, you would talk to your patients about, or is this something that patients would talk to their doctor about?
Well,
you know, what's your recommendation?
I think that we can feel empowered to speak about our weight with our primary care or any doctor that's around us, or healthcare professional. Sometimes, like, we are a newer field, so I think the last number is there's 6,000 physicians that are certified by American ABOM and American Board of Obesity Medicine.
Yeah, American Board
there
of
aren't
Obesity,
enough of us to go around, but I think a lot of people, especially with some of these medications, we are, like, I think the tide in medicine is changing, where we are understanding obesity as a disease, and there are more treatment options available than eat less and move more. I think a great place to start is with your doctor, and then the Obesity Action Coalition and the Obesity Medicine Association, both websites have directories on their pages for patients to access, just to start the conversation about, like, who should they see, what medications are available, and to go in it that way. I will say, though, when we want to talk about lifestyle and weight, it's important to schedule an appointment just on that. Like, sometimes when we go to the doctors, we'll think about addressing like 5 or 6 things, and that's not really practical in a visit because there's only so much bandwidth and time allotted. But if this is something heavy on you and you want to talk to your doctor about it, just schedule an appointment for that reason.
Right. And along those lines, when we talk about, medication management in addition to lifestyle for patients with, excess weight, once they start medication, I know we talked about, a long-term medication, but what's a good expectation for patients to have with regards to what types of results they have? I mean, like you said, it's not a quick fix. We can't make people lose, 10% of their body weight overnight, even with some of these medications. So how do you counsel your patients when you tell them, what to expect, in addition to talking about the complications and side effects? I'm sorry, not complications, but side effects of the medication. What do you tell patients when you say, okay, you're going to come back to see me in 1 month, 2 months, 3 months, and what should we expect during that time?
I keep a close tabs on my patients. That's part of the design of my practice. So we have more frequent visits and access to see me. I start the conversation always by saying, let's set realistic expectations. We're looking for 10% total body weight change over the course of 6 months on full dose of medications. Because if we're starting in GLP-1, it takes 3 to 4 months to get to full dose. So then the gold standard for each medication, we actually look at 5% total body weight loss. So if we add it up, like lifestyle therapies might give us 5 to 7% of total body weight change, and then a medication may give us the other 2 to 10 to 15% total body weight change. And really, at some point, your body will reach a new weight set point, and at that point, we can kind of just see where we're at and see if there's anything else where we can strategize to lose more weight, or we really just start recognizing that it's not that any treatments failed, but we've reached their maximum kind of potential. And I think that's very important. Right. So someone who is going through this journey, like I said, just like I can't change your height or your hair color naturally, I may not be able to reduce you down to a quote unquote normal BMI, but that's not the goal. The goal is to improve your overall health and total health outcomes. So it might be, you might still be in that category.
Right. And sometimes the goal for some patients is, like you said, non-scale victories, but also to improve their health. So for example, reverse diabetes, or help them with their blood pressure control, or lower their cholesterol. And, do you feel like those are also good goals for patients to have with regards to, starting some of these medications?
I think it's a terrific goal. I think it's always great to get medical conditions under control, and that's how we improve our longevity.
Okay, great. Well, thank you so much for taking the time today to talk to me. Is there anything else that you think people should know, and how can they reach you if they want to talk to you more about obesity medication?
And it's not just medication. I'm going to add that too. I have a whole panel of patients who some simply just still want guided lifestyle advice, and that's where I come in from the health coaching perspective as well. And so there is a big mindset shift that some people want to work with me for too. So I'm here really for the full spectrum of care. I'm in Orlando.
Great.
Yeah, I'm in Orlando. My
great.
practice is weight-sense.com online, and my phone number is 407-753-5036. So I'd be happy to help people along their journey.
Okay, great. Thank you so much. And is there anything else that you feel that we should know about you, or just about this journey that you help patients with?
No, I just think that if you're watching and you want to work on losing weight and improve your overall health, find an obesity medicine doctor near you. Talk to your healthcare providers about this, and don't give up hope. There's so much that we can do to improve our well-being, and it is a tedious journey, and there is no magic formula. So we just stay the course, but we're going to succeed, and there's health out there for you.
Okay, great. Thank you so much, Dr. Shah, and thanks to all the listeners who are watching today. We will send a little bit more information about your practice after this.
All right, thank you
after this
so
Instagram
much.
live.
Bye.
Thank you.